Well, if I'm honest, one of the main reasons I applied to the GBHI was the interprofessional nature of the cohort. I think really what's important as an academic is challenging the status quo of working in the same lab with the same individuals who hold the same views, who hold the same theoretical views as you do. And I think by working with individuals from different backgrounds, with different views to your own even, you really challenge that. You're breaking boundaries, you're fostering understanding, and I think we can make real advances in dementia research and in brain health research by breaking those boundaries, working with people from different views and really fostering an understanding.
When I'm around all these people, they're all approaching the brain, but they're approaching the brain from all these different angles and from all these different specialties. And it has the effect, being around them and being in class with them and hanging out with them and having lunch and stuff with them, it has the effect of starting to connect things in the world that I never connected before.
You not only develop these skills and opportunities in the moment that help you grow in leadership positions, but that you have a network of people which grows over time that you can return to again and again as you need reminding of the lessons you learned or as you need them to teach you what they've learned along the way so that you too can continue to grow.
Well, the annual meeting for me was, I guess, a moment where I got to meet all of the Atlantic Fellows, those that had come before me and those current Fellows based over in UCSF and here at TCD. And for all of us to get together and share our experiences was absolutely incredible. But as well as that, what really stood out for me at the annual meeting was hearing about the work of the senior Fellows that had gone ahead of me. And although a little daunting to hear about their wonderful work, and they set the bar incredibly high for the current Fellows, it was also very encouraging to hear about the advances they have made in the short period of time they had been at the GBHI and after the GBHI. So that was incredibly valuable for me.
It's helpful not only to make you feel like you're part of a family, part of a community, also to allow you to see what they are doing, what is coming, what are the next opportunities, how you can collaborate, how are you going to do more networks, to understand what is going on in other countries. So I think that the annual meeting is great to once that you have been working during 1 year or during certain time, it's perfect to try to put all in order and say this is where we are and this is where we are going. And I really love that.
I can begin to empathise and understand the situations and systems that people are living and working in. Empathy in terms of those who are beginning a journey with the diagnosis of dementia and empathy towards those who are supporting those people on their journey.
Me as a clinician had a very, I could say now, a narrow point of view focused on the patient and what's going on with them only. And after having all this different points of views and new knowledge, now I can understand that there's different ways I can impact what's going on in dementia.
I think the most valuable learning experience came from the people in the GBHI community. The people in this community believe in giving rather than taking. They believe in the core values of GBHI, and they lead by setting an example themselves. So they practice or they embody the core value in their daily practice, and by witnessing that, it is inspiring and a life-changing experience, and it inspires me to try to strive for the same.